Hello everyone, I am Dr. Navajit Das, consultant urologist working in Guwahati. Today my topic of discussion shall be the most commonly done surgery for large kidney stones, that is PCNL or Percutaneous Nephrolithotomy. Now, what is PCNL? In large kidney stones which are not suitable for no incision surgeries like ureteroscopy, also known as URS, RIS or ESWL. In these scenarios, the single setting removal is done by a technique called PCNL. Here, a tract is established into the kidney and stones are fragmented and removed with the help of an endoscope called nephroscope. Here we can see that these are the stones and this is the scope, and the stones are fragmented and they are taken out through the sheath with the help of a nephroscope. Now, what are the indications of PCNL? PCNL, normally there are three kinds of surgeries which we do for kidney stones. One is URSL, that means when the stone is lodged in the ureter, we go through the ureter via a ureteroscope and remove the stones. Or RIRS, if the multiple stones are there but smaller in size in the kidney, then we go via the ureter into the kidney from through the urethra. But in cases other than these, like large stones, if they are, for example, in this picture we are seeing that this is a preoperative picture on the right side showing a staghorn stone of 5 cm. This is a huge stone which is covering the entire kidney with a lot of secondary stones. So this is not suitable for the RIRS or URS. In that scenario, the option is open surgery or a minimally invasive surgery, that is PCNL. And this is the picture taken after the completion of the surgery. Here the stones has been removed. So the indications are the large kidney stones like more than 2 cm, complete staghorn stones or partial staghorn stone. Staghorn stone is a stone in which the entire kidney is filled up with stone, like this is a staghorn stone. Now, the technique of PCNL, if simply taken, it includes 4 or 5 steps. The first, the patient is taken under general anesthesia and a ureteric catheter is placed. A ureteric catheter is a catheter which is placed, a pipe which is placed through the urethra into the ureter and into the pelvic elevation system, which is the kidney. The basic idea of keeping this, the purpose of keeping this catheter is to infuse dye or contrast so that we can visualize the pelvic ileal system under fluoroscopy, that is X-ray, which will help us in guiding the puncture of the system entering into the system. Now the ureteric catheter has been placed as this is shown. This is the ureteric catheter, the dye has been infused, and this is the needle, the IP intermediate puncture needle through which the guide wire is placed. Next is target area localization of the target area of puncture. This is localized with the help of fluoroscopy, which I have already told you. Then this is the puncture we are doing here. This on the right side, these are the stones image taken, and this is the this is the ureteric catheter. This is the visualization of the system. The puncture needle has been placed, then I put this is the guide wire which is placed. This is the main thing over which the dilatation of the tract will occur and we can get access to the kidney. Next, after putting the guide wire, we have to dilate the tract up to the appropriate size. For example, if the stones are small, multiple, then we can use it as a mini PCNL like 16 French. It's a very small size. Or if the stones are large, we can increase the tract size depending upon the bulk of the stone that removal is needed. Next is the nephroscopy and lithotripsy. Once the tract has been dilated, we put a sheath, and then inside the sheath, through the sheath, we put the nephroscope. We visualize the kidney, the entire stones are seen, and then the lithotripsy is done with the help of laser energy or pneumatic lithotripsy, and then the stones are extracted. Now this is a video showing the description of the procedure. The first video has been taken, the animation has been taken from European Association of Urology. here this is the kidney ureter system, and this is the bladder, and this is the Foley's catheter. We put the ureteric catheter as I have said, and we visualize the system. This is the X-ray view. Then a needle is punctured. Then we put a guide wire. The tract is dilated. Then we put the this sheath inside through which the nephroscope is placed. It's laser fragmented. Stones are fragmented, and then it's cleared and it's seen in the X-ray. And the stent is placed. After the stent is placed, we may put a PCN, which is removed usually on the next day. Next, this is a procedure, a picture of the mini PCNL which I am performing. Here this is the patient, which is prone position. This is the C-arm. This is the monitor in which we are seeing. And this is the tray where all these scopes are placed, and this is the laser machine, and this is the laser fiber. It's a fine fiber through which the energy is passed, and this is the laser fragmentation of the stone. We are fragmenting the stone in this way. The advantage of laser energy is that it, in comparison to the pneumatic energy, is that it doesn't injure the surrounding epithelium, and the removal is very powerful in case of and good in case of the laser. So these are pictures of my various PCNLs, where we can, on the right side, we can see the preoperative image of the stones. On the left side, it's taken after the complete clearance of the stone. So these are the tracks through which we have entered, and we have removed the stones successfully in many hundreds of patients. So this is just Staghorn stone. So the one thing I would like to tell you regarding the PCNL is the advantage of PCNL is because it's only a single incision surgery, and we can remove the stones of varying sizes from 2 centimeter to 5 centimeter in also complete Staghorn stone with minimal bleeding and minimal injury to the kidney. So this is the advantage, and the patient can go home the next day. There is little bit amount of bleeding, and which is considerable, and the patient can return to work very early. In the earlier days, the kidney stones were removed by open surgeries, which added morbidity to the patient, and also the kidney scarring was very much. But with the help of this PCNL, the scarring of the kidney and the kidney function is preserved. So the advantage of laser energy over PCNL can be shortly taken as a shorter length of hospital stay, shorter postoperative pain, lower analgesia requirements, faster return to activity, and lower treatment cost. Thank you.